Hello and welcome back. This is Dr. Steve, your physical therapist. And I wanted to get started talking about some real applications that you can start using and start thinking about. And also just things that I do on a day to day basis, especially being a physical therapist. It's not that uncommon for me to look at balance. It is something that I screen for a lot, and it is something that I see people struggle with a lot. So I wanted to take just a few minutes and explain what balance is, what systems are actually involved, and then also explain a little bit of the data that we actually have on balance so that you can just get a little bit of a better idea. And then from there, I want to go into an actual application and what I would do really in a setting of looking at balance, how I screen for it, how I maybe diagnose too if there is a problem, and then what are some easy things that people with balance deficits can try to improve their balance right at home. Always thank you so much for subscribing and liking the video. And also, please make sure you read that disclaimer. It's the very first thing under the description. And please, this is a very important video for you to stay safe on and to be very smart. Use common sense when thinking about testing balance and doing anything else that you might see out there on the internet. Always, I stress safety first. And if you don't feel safe, then you probably shouldn't do it. So, with all of that said, let's jump right into what is balance. And I have these pictures here. And really, when you start talking about balance, you start talking about our three systems that are really integrated, that then deliver a lot of information to our brain to help us with the idea of balancing or staying upright and not falling over. The first one's vision. And you can probably guess why. And if you've ever tried to do anything with your eyes closed, it's a little bit harder. You might even have noticed that you wobble a little bit. And so as we get older, we know vision typically declines or deteriorates. It gets a little bit worse. So vision is something that we're always thinking about. If there are some visual deficits, usually we have to correct those. Those are not going to necessarily get better on their own. And the longer you, at that point, if you're going to have vision deficits, it's probably going to impact your balance to some degree. So always looking at vision, always making sure that the person is wearing glasses, if they need to wear glasses, contacts, whatever the case. The next, I have this man here, really to symbolize the ability to know where your body is in space. And that's something we call proprioception. It's a big fancy word, but it's a very simple meaning. It's the idea of knowing where my body is in space. It's a lot like being able to feel. So literally when you're standing on the floor, ground, wherever you might be, it's being able to feel the ground underneath your feet. And a lot of the times how I explain this, whether I'm talking to somebody with diabetes or not, I'll explain to them with diabetics, you may or may not know this, but a lot of the times diabetics have a really tough time being able to feel the sensation of the world underneath their feet. And a lot of that has to do with the disease process, is that a lot of times there's restricted blood flow and there's some nerve damage, and they literally have a hard time feeling the ground or the floor underneath their feet. We call that diabetic neuropathy. That's just one piece of that, but it helps people to understand that when you lose that sense, it's harder for you to know where your body is in space. It's harder for you to self-correct. It's harder for you to really know what's going on. The less that you feel of the world, the less reaction that you have to it, and or the delayed reaction you have to it. So that's a really important piece. The last one here is just a picture of the inner ear. And we talk about a lot of the times the inner ear function being so important too. If you've ever had an inner ear problem at all, then you know that that could lead to disequilibrium. And anytime you have any equilibrium issues, you might feel a little wobbly there. That is, again, a big part of our balance. So I think of these three things as all coming together, being very integral in how we actually balance and how we actually stay upright. So now with that said, I'm going to bring in an image here that's going to talk a little bit about the data. And so really I'm paying attention. I've highlighted some of these. I'm paying attention to the ages. You see that 18 to 39, 40 to 49, 50 to 59, 60 to 69. It continues, 70 to 79, 80 to 89, and then a total. What I'm really looking at here, I highlighted eyes open, best of 3 attempts. That's best of 3 trials of this standing on one leg and counting the seconds here. So if you see, well, let's just take 18 to 39-year-olds, female to male. We had 44 female participants, 54 male participants. Here's the total, 98. But for the females, best open, overall, their eyes open best of 3 trials. It came to here 45 seconds, 44.4, says 45.1, 44.4, with the total here being 44.7. Just keep that in mind and watch what happens. This is the unipedal stance test here. It's a single leg stance test, standing on one leg, basically. Age group and gender for eyes open and closed. Check just this category here as we go into the next several decades. Remember what the numbers were, 45, 44. Look at 40 to 49, drops down to 42 and 41. 50 to 59 drops to 40.9 and 41.5. 60 to 69, 30 to 33. This is female to male. 70 to 79, 16.7 to 25.9. 80 to 89, 10.6 to 8.7. So I really bring in this data here to not only help you see a trend, which hopefully you do. You notice that as we get older, that time of us being able to stand on one leg gets less typically over time. That deteriorates, that gets worse. Balance typically gets worse over time. So as a PT then, I'm of course evaluating, screening for, and keeping my eyes open, especially when I start getting into some of those older populations. You really see it decline pretty drastically from the 60 decade here to the 70 decade. That's a big drop right there. So having that in the back of my mind whenever I'm working with somebody is important. But listen, there are plenty of people who come to me who are younger and might have some issues that they need some balance work. They sprained their ankle, for example. If you've ever sprained your ankle, you know that your balance is going to be a little bit off. And so there's a lot of different reasons why I look at this and why I pay attention to this. It helps me make recommendations, and it helps me build that much more of a comprehensive home treatment program. So I like to include the data here and help you understand where I'm coming from. We are going to take a look at some real life applications here in the next section of the video. Stay tuned. And as always, please post any comments or questions that you have right down below. I'll get to every single one of them. And first and foremost, always stay safe, especially when you start looking at something like this video and any other things that you might see on the internet. Okay, so I'm going to stress that a lot in this next segment. And again, let me know if you have any questions. Okay, so let's talk about balance. And so the very first thing that I always talk about, whether it's a young individual, an older individual, anybody in between, we always talk about safety. So that's why I've brought in this chair. It's sturdy. It's really sturdy, 4 legs, and it really takes a lot for it to tip. But I wanted to make sure in the shot here, you are also able to see a really sturdy kitchen counter here. So that's another option. You can always use the inside of a door threshold. So you have the door, it opens, and you've got the frame right there that you can literally hold on to from both sides standing inside the door threshold as well. So I always tell people too, if you feel unsafe and you already know that you have some balance issues, when testing this stuff or when doing anything like this, maybe you're doing some exercises that a PT has already given you, or you're just looking for some balance exercises, always choose the safer option first, and especially if you already have some balance deficits, some known balance problems. I would go with the counter because I can literally put my hands on it and I can be right here while I'm doing some of these different balance exercises. For me, because I know my balance is okay, I'm going to just demonstrate with the chair, but know too that I have this counter just in case, and I feel super safe in that scenario. So I always check feet together first and see how that looks. You notice that I'm holding on to the chair. So this is what I tell people a lot of the times. If you're holding on to something, you're not getting a true measure of your balance. So in that case, if I'm going to be super safe, I'm going to have it here by my side and kind of in front of me. It's almost kind of diagonal. It's not straight to my side and it's not straight out in front of me, but it's more so kind of just diagonal, just so that I can show you. If I was doing this on my own, I'd be fine with doing the demonstration just like this, but I want to make sure that you guys can see what I'm doing here. So I've got my hands near it, almost touching it, but I'm also getting a sense of how my balance feels now with my feet together. And that'll hold for 60 seconds there. From here, I also test eyes closed. Again, if there is a balance problem that you know of, remember what we talked about with balance. Vision is a huge, huge fraction of your balance. So by taking vision away, it's going to make this exercise, it'll make anything with your eyes closed harder. We rely on our vision so much for balance and for being able to stay upright in our world. So I won't do that here, but that is something that I'll test. I'll also test what I call tandem, which you can't really see what I'm doing from this angle, but I'm literally putting my feet in tandem, one foot in front of the other, and then I'll flip 60 seconds there, and one foot in front of the other the opposite way, 60 seconds here. And then I might do something like I might try some tandem walking with people, but again, these are things that come with some inherent dangers if you're doing this stuff by yourself in your house. So I recommend, if you know you've got some balance problems and you're not able to catch yourself, remember the disclaimer in this video. Always, always, always keep yourself safe and choose wisely here, okay? I'd much rather be in person with somebody doing this stuff, and or you can have somebody who's with you, a family member or a friend, also be a guide and be a spotter for you right beside you, ready to hold on to you, catch you if you do have some balance problems. So that's where I like to be, right there with the person. Typically this is a PT or an OT, physical therapy or an occupational therapy type thing that happens a lot in practice. But I like to screen everybody that I work with. It just makes sense, especially if it is lower quarter, lower extremity issue, and then it's also going to be something that is important to keep healthy and maintain. So if you have some issues, remember, a lot of these are going to be very difficult for you. A lot of this is not going to be something that's really easy. But I also want to talk about some ways that you can practice some of this stuff really safely right in your own home. And so from there, once I have a good estimation of where the person is, if they're still doing well, I'll have them go right into a single leg stance test. Again, I've got the chair here, I've got it right here, or I've got the counter right here. I'm not necessarily gripping and holding on to it at the start of the test, but I have my hands right above it, and I'll go right into a single leg stance. Now, a lot of the times when I'm working with people, they might start to veer over. They'll put that foot down as a corrective. That's a proper stepping sequence right there. It's a stepping strategy that prevents you what? From falling over, right? Or I might see some people get here and their other leg will touch, or their foot will have to drop down, or they might have to catch themselves on the counter because they're shaking and wobbling, right? But I test that, I count that. There are norms. I'll link that into the description as well. There's norms given age ranges. A lot of the times, what I am immediately looking here for this test is that, can you hold this at least for 10 seconds? When I was going through school and working with all the different instructors and working also out in the field, a lot of the times we talked about 10 seconds being really important here. And that if it was less than 10 seconds, you were that much more of a risk for falling. And so if you can't do this for 10 seconds without gripping or holding on, you're at that much more of a risk for falling with injury, and that then it's recommended that you get an assistive device, something like a cane, a walker, crutches, whatever might be appropriate given your age, your injury, pathology, whatever might be going on. So that's how we make our recommendations too. It's not just made up. There's actual numbers. There's some data that we're trying to get there. So a lot of the times I'm looking for that. I'm looking for what's happening to your body. Are you swaying? Are you all over the place? What's happening here? Are you using more of a hip strategy? Are you using more of an ankle strategy? There's a lot of things I'm looking for and what's happening, and then that helps me determine what we really need to work on as your physical therapist and in your physical therapy program, your regimen, your home exercise program, right? So I look for that. And then once we get done with some of that, now remember, this is a very minimalist balance testing sequence. It can get so much more complex when I start bringing in some of these tests with a whole lot more tests kind of within them that give me an even better understanding of what your balance is throughout your lower half. But this is minimalist. So a lot of the times what I tell people they can do immediately, if you want to start improving your balance, is to take one of these tests and start working on them. So I'm going to go over to my really safe counter here. And what I'm going to do is I'm going to do exactly as I showed you guys, but let's pretend that I'm a little wobbly. And every so often I need to put my hands down. Well, instead of just failing, right? Instead of just every couple of seconds just failing, why don't we turn this into something where we can use our hands as a means of helping to improve our balance and work on that balance? And this is what I mean. If I'm here, watch my hands as I start to veer over. What did I just do there? I corrected, right? And I'm using my hands as a means of correcting. If you want to think about this as my counter right here, so I can come in to the shot a little bit easier so you can see, I'm standing on one foot and I've got my hands hovering over my counter, and as I feel like I'm falling, what am I doing? You see how I'm still staying on one foot and I'm practicing. I'm getting that practice while still being able to stand on my leg. That's actually contributing to working on that more. Now, if I'm starting to get really fatigued and wobbly, take a break. But you can come back to this and you can use this as a tool now to work on your balance right at home. This is such an easy exercise that I can do here and that I can show people how to improve your balance. So try it. Thanks for being here. This has been Balance with Dr. Steve, your physical therapist. We'll see you next time.